Well, Sunday is World Mental Health Day. During the past year and a half, people have had all kinds of experiences that have challenged their mental well-being and have turned to different ways to cope. And it's clear that for many, that has been drinking more alcohol. And according to the National Institute of Health, alcohol consumption has increased significantly during the pandemic. Many are drinking to deal with stress because it temporarily makes them feel good, but heavy drinking can actually increase anxiety and harm mental well-being. To learn more about this spike in alcohol consumption and how it can impact well-being, your mental health well-being, and to learn better ways to cope with stress, we are joined by the medical director of our sponsor, Blue Cross Blue Shield of Michigan, Dr. William Beecroft. Thank you so much for being with us, doctor.
Good morning. Thank you for the time this morning.
It is our pleasure. Now, what are we seeing when it comes to people's relationship with alcohol during the pandemic?
It has substantially increased. A lot of people have found that they're using much more alcohol than what they normally had previously. And we're seeing the consequences of that now that it's been roughly, a year and 3/4 that people are really tolerating to alcohol use and seeing the depression that goes along with it.
Wow. Well, if people are concerned about their mental health and depression and alcohol use, what can they do?
Looking at different ways of being able to decrease anxiety, address the depression, the stresses that we have, alternatives to alcohol. Alcohol gives you a very short-term relief of symptoms because you're releasing the chemicals in your brain very, very quickly. But once that's gone, it's very hard for your brain to recreate those chemicals at a faster rate. So you end up being more depressed or more anxious recovering from the alcohol use than you were when you first started using it. So doing things to be able to relieve stress, exercise, you hear that a lot, eating appropriate foods, decreasing the amount of sugar, that sort of thing. Looking at meditation, talking to a friend, partner, or loved one. These are really helpful things to do. And also with people that have a spiritual advisor, being able to talk to them about how that might be an option for them to relieve some of the stress. And looking at mental health professionals earlier than later also can be very helpful for people to get back on track.
Great suggestions. Now, how can people get help if they feel like they need it?
There's a variety of different sources. With Blue Cross Blue Shield, you can call the number that's on the back of your card if you have our insurance. But even being able to call our helpline to be able to do that, and with the substance use and mental health services helpline that's on the screen there, that is a very good resource to be able to look at what the local resources are in our communities to be able to get services. With alcohol use, you can always go to an AA meeting 24 hours a day, 7 days a week. You can do it online. That's an option to be able to learn how to be able to address alcohol use disorder in particular. And for spouses or significant others, Al-Anon is a great resource to be able to find out what to do locally.
Great information. Now, here's a big question. Why is changing the stigma around mental health important for you?
People have always been, as part of our development as a species, always been afraid of showing weakness of any kind. And with mental health issues, the stigma that surrounds it implies that you are weak, that you should, in quotes, pull yourself up by your bootstraps. Think about ways of being able to do this. And it's not like that. It's a medical issue. Even though it has behavioral consequences, these are problems that you could seek services for like you would go to your regular doctor. And that stigma is decreasing, but it needs to decrease even more, that it's not an issue. It's actually more stigmatizing if you don't take care of your mental illness than going ahead, recognizing you have a problem and getting services to treat that.
That's right, and let's hope that that decline in the stigma continues in that direction. Doctor, thank you so much for joining us this morning. For more information and to get help regarding your mental health and mental well-being, visit the website Blue Cross Blue Shield of Michigan's website, bcbm.org. bcbsm.com/mental health. Again, that website is bcbsm.com/mental health.